The program is organized by MESS Pillai College of Education and Research Chembur for knowledge empowerment with our esteemed guest Dr. Milind Ruke. The world has made significant progress since the late 1990s, but HIV remains a major global public health issue. And like many other major issues, it faces additional challenges during this COVID 19 pandemic. We salute all the AIDS warriors on this, which is celebrated every year on December 1st to raise awareness about AIDS. PCER Chembur is fortunate to have renowned diabetologist and general surgeon Dr. Milind Ruke, who has consented to spend his valuable time with us, and he will throw light on some sensitive issues related to AIDS. Let me take this privilege to introduce Dr. Milind Ruke. From the PPT kit, you can understand how busy he is, but thank you so much, sir, to consent and be a part. Dr. Milind Ruke is highly educated, experienced, and accomplished professional in his field. Doctor is a general surgeon, diabetic foot and limb salvage specialist, associate professor, general surgery, diabetic foot and hyperbaric division at JJ Hospital, adjunct external faculty. Is also international coordinator for Indo-US exchange program on MUHS Inspection Committee, Maharashtra government. I think so. I got missed. I'll just repeat the last slide.
We welcome you, sir, for this session on AIDS Day. We are highly privileged that you are here with us today, sir. As we begin, sir, indeed, this awareness on HIV is something that really can take us through in understanding this entire stigma, this as a disease that we may look up. So we look forward for your presentation, sir.
Yeah, thank you, Ravi.
Thank you, sir.
So this day, 1st December, which has been celebrated across as a World's AIDS Day, and it is really a good uh, day to discuss about different aspects of HIV and AIDS. And I thank the Pillai College of Chembur and the administration who has um, given me this opportunity to discuss about this dreaded disease, which started long back in the 1986 when we had the first AIDS patient in Chennai in 1986 in a sex worker, and that is how then we had uh, in between almost a pandemic of HIV uh, disease. So, to take you all into knowing the basics of HIV and what is there, I am going to use the National HIV Program guidelines, which is freely available on internet and in medical colleges. So, to start with the basic facts, let us start what is HIV. HIV abbreviation means human H immunodeficiency virus. So it is only found in humans, transmitted among humans and preventable by humans. And it is associated with an immunodeficiency which is caused because of the virus, which is again a small germ, as now we have coronavirus. And this, once it gets into your body, you are HIV positive if you don't take the prophylaxis of HIV medicines, and you inadvertently get this virus through different modes that we are going to discuss. And then this virus multiplies in the body and it is released all over the body, especially the CD4 cells are affected. This virus replicates in the CD4 cells, destroys the CD4 cells, and many viruses are released in the system, causing an increased virus load and decrease CD4 count. The moment your CD4 count is a cell in the body, which is a defense cell, a lymphocyte, and when the CD4 count decreases below 200, then you can say that a full-blown AIDS has occurred. So patient may just have virus in his body and his CD4 count may be very good, and then he is HIV infected. He can transmit the virus to different people. The moment he doesn't take medicines and there is nothing done about it, and the HIV starts replicating and becoming more and more viruses in the body, and the immunological system decreases, you get something called a multi-organ disease, which is called as AIDS. So let's see what is AIDS. The next slide is will show you that AIDS is an acquired, which means we acquire it, doesn't come inherited. Immuno, it's linked with immunodeficiency, means a lack of immunity because of uh, the lymphocytes been destroyed, and there is a group of symptoms of disease which are all opportunistic infections which happen in the body. So you get a syndrome, a group of diseases. So it is called as acquired immunodeficiency syndrome. So this happens when your defense mechanism reduces to a very low level, and the marker is the CD4 cell count, which is less than 200. This can be done as a test. So we do CD4 and CD8 count, and that is how we know that the patient is in full-blown AIDS or is just an HIV. So, and then what is the prognosis, how much time he's going to survive. So about the HIV, it is found in body fluids like semen, breast milk, blood, and vaginal fluid. So these are the fluids through which it can be transmitted from one person to another. Like in semen, if you do unprotected sex or you have sex with uh, a person who is infected, and a mother can also transmit the virus through a breast milk. A blood transfusion can cause infection, and of course vaginal fluid, and that is how you get infection of HIV through unprotected sex. The next is how HIV is passed on. So again, we'll repeat it during unprotected skin to skin contact of sex, anal or vaginal or oral sex. The it is more transmitted. The rate of transmission is highest in anal sex, followed by vaginal sex and oral sex. Contact with HIV infected blood or blood products like blood transfusion, or people who are sharing IV drug needles or HIV positive people. So you have people who are taking IV drugs uh, uh, every day, who are drug addicts, and they're reusing the needles. You can get in people who are having blood dyscrasis, and they have to be you know um, given blood transfusion repeatedly. from HIV positive mothers to child and during breastfeeding, which we just saw. So but what are the things, what are the fluids where normally you do not get HIV from? So they are the tears a person is crying, saliva, sweat, urine of an HIV infected person. So these are the myths that uh, if you touch the patient, you may get HIV. This we have to spread in the society, that taking care of a HIV positive patient, um, giving him empathy or sympathy, uh, putting a hand around his shoulders will definitely not have a transmission of that HIV to you, unless you have the other criteria we saw. You won't get HIV by just being in contact, or just being with the person, or talking to the person, or sitting across and taking care of the patient. The next thing, that is the window period. So if you are in contact with an HIV patient, you have to do a test. So there are ELISA tests, there are uh, different tests, tried out tests, which you have to do. Then you have to confirm with RT-PCR test. But when a person is infected, it may take 6 weeks or up to 3 months before antibodies to HIV are detected in the blood. The HIV test looks for antibodies. When these antibodies are detected, the person is diagnosed HIV positive. A person can be positive and the test shows negative because the test was done during the window period. So what does that mean? That means the patient is got infected with HIV, but he has not developed antibodies. And when you do the test between 2 to maybe 6 weeks in between, and you may get a false negative, but the patient is infected and the antibodies are not developed. So in this window period, if you do the test, then you may get it negative, but the patient can be HIV positive. So it is always recommended to repeat the test the second time after 12 weeks. Uh, One good thing about HIV is that though it is going down, worldwide data show that it is going down, it is still there. There is no vaccine for it, because it's very difficult to make vaccine for HIV. As corona, we are still having vaccines, but HIV we do not have vaccine, because the proteins is changing its place um, off and on, and so you cannot target the protein where the vaccine can be developed for it. So that is the problem. So why HIV rates are not going up considerably? Because there is no sex education. Sex at an early age, we are seeing throughout the cultural changes, little life skills and sex education. Condoms are not used as it should be used. Multiple partners, it's an era of revolution, of cultural revolution, and global people are becoming global citizens. So multiple partners, stigma and discrimination, uh, sex for money or sex for other things, substance abuse like ganja, cocaine, alcohol, where people are taking uh, IV or subcutaneous drugs, men having sex with men, gender inequity and gender roles. Now, sexually transmitted disease and HIV, there is a link. So, if you have sexually transmitted disease, you are more exposed for HIV, because you have small ulcers and wounds on the sexual organs through which the HIV can be transmitted. So, if you are a sexually transmitted disease, if you have syphilis or gonorrhea, you have more chances of getting an HIV. Um, you can get a sexual transmitted disease by having sex without a condom with an infected person. At the same time, you could be getting HIV, which is also contracted by having unprotected sex. But all sexually transmitted diseases are preventable. Most sexually transmitted diseases are treatable, but HIV/AIDS cannot be completely cured. That has to be understood. It can be just controlled. So you see the incidences you'll have in 2019 data, 38 million people living with HIV all over the world. People newly infected are 1.7 million, and HIV related deaths were reported at 690. Um, Number of new HIV infection 2018. If you see, you can see in the map, the more HIV cases are in the African continent and especially South Africa. You have also in the Southeast Asia and in US. Uh, if you see India, there are 2.1 million people living with HIV, 0.2% adult HIV prevalence, 88,000 new HIV infections. This is a 2017 data, and AIDS-related death 69,000. 56% adult on antiretroviral treatment. So antiretroviral treatment means normally people are given three drugs as a initial treatment, which is for HIV. The status of HIV epidemic in 2019, adults between 15 to 49, the prevalence rate is about 0.22 uh, percent. Number of people living with HIV in lakhs is 23 to 49 lakhs, and new HIV infections in thousands is 69 thousands, which we get every day. Now, one better sign is people are becoming aware. That's a good sign. And you see in India, data from 1998 to about 2006, there is a little downward trend in the incidences, but still we are not able to go out. There are still a lot of cases. Now, modes of HIV infection, something that we should know is semen and vaginal fluid, sharing needles, needle stick injury while doing surgery. So doctors are also too much prone to get this while doing emergency surgery where the HIV report has not been done or is false negative. Patient is in window period, so doctors can also get needle stick injury. So they are advised to take prophylactic two drug regime. It can also happen through infected blood, and we have got a lot of cases where infected blood has caused HIV during pregnancy or birth. So, HIV positive mother, she can transmit it to a child about 1 in 20, and breastfeeding can also cause transmission. So, this is the structure of HIV. It's an RNA virus, and it has got protein cover, and which when enters the body, it undergoes different stages of it first enters the CD4 count, goes to the lymph node, enters the CD4 cell, and undergoes different 12 mechanisms like binding first, then fusion. In That means the shells is lost and it gets into the CD4 cell. With an enzyme called reverse transcription, it gets multiplied and then it is released outside the CD4 cell to infect other cells, and thus this is how the viral load increases. If you do not treat the HIV infection slowly, if you see the next slide, is that over 10 years the patient develops AIDS, and patient so these are the stages which the virus enters the body, loses its shell. The reverse transcription enzyme causes multiplication of the virus. The single strand becomes double strand, then it is broken into different small bits, and these virons are released, assembled and released outside the circulation, and it goes and infects other cells. Now, if this virus load increases, then you get AIDS, and if you don't treat it by antiretroviral therapy, then you get lot of symptoms, and within 10 years, in the slide, if you see, the within 10 years, the CD4 count decreases below 200 and patients succumb to opportunistic multi-organ infections and can die because of AIDS. Next slide.
So, may I interrupt you here because
Yeah.
I really got so curious about knowing all this. So, we commonly call HIV and then we keep telling AIDS. So, is there a difference between HIV and AIDS?
So in the initial part only I explained when the HIV virus, which is an RNA virus, enters the body of the person through blood transfusion or through unprotected sex or from mother to the child, the HIV virus starts multiplying. Now, if you have taken prophylactic medicine, like two drug medicine, or immediately if you've started, now the tendency to start antiretroviral therapy as soon as you detect HIV, then the HIV virus is not allowed to replicate, and it replicates in the CD4 cell, which is a defense cell, lymphocyte. So when it is not allowed to replicate, the CD4 cells are preserved. So you get CD4 cells in abundance and the virus is not replicating. So your HIV is controlled. You remain controlled and you don't proceed to AIDS for a very long time. Now, if you
Yes.
don't treat or you miss the antiretroviral drug, you may develop resistance and the virus starts multiplying. The CD4 count will decrease to less than 200, so it is not able to defend your body. You get a lot of opportunistic infections, and ul- ultimately, because you go into a syndrome where you get different infections in different parts of your body, fungal infection, viral infection, bacterial infections, and the entire body becomes infected. You become weak, you become thin, you lose weight, you lose appetite, and that is when you call it as AIDS. So HIV infection or HIV positive is different, and AIDS is the full blown disease caused by HIV infection when you don't treat it or don't control it. I hope I've answered your
Okay.
question.
Yeah.
Yeah. So the
Yeah.
next slide,
Yes, yes, sir. Thank you, sir. Thank you, sir. I'll move on to the next.
yeah, yeah. So the next slide, if you see the in tube, it is shown that there are cells which are normal. So you get a HIV virus which goes in, starts infecting the cells, starts multiplying, and this is the if you see the last slide is a stage where there are a lot of viruses and less of CD4 cells. So that is AIDS. Okay, so that is irreversible. Once you go into full blown AIDS, then you cannot save the patient. So it is this period, this early period, when you should start the antiretroviral. There are about 12 types of antiretroviral therapies which are available now. There are very new drugs which are come, which you have to take. Um, you may not take daily also, but in India we have got three drug regimes that we have to start, and they are excellent. Like you can live a normal life, you can also rehabilitate the patient, you can tell the patient about what he should be doing, what lifestyle changes he has to be doing, and how he has to be aware. He should not feel socially discriminated. The other society should not discriminate him and accept him and live. He should be able to live a normal life. We see a lot of problems. They are not employed, and all those things. So that's all those social problems has to be tackled at a different level, not at only at the society, but there should be laws. We should be framed for that. That is what I feel.
Yes.
The next
So,
slide.
sir, that stigmatization is the highest kind of mental, psychologically that affects any humankind. Because the moment you are stigmatized, then you really lose your morale even to proceed to any further steps in the society. I do agree. And as you rightly said, the early signs and symptoms have to be really looked up when you have, so that you don't end up into those multiplying signs where it becomes just irreversible. Yes, sir.
Absolutely, absolutely. I totally agree with you. In our medical field also, when we have a HIV patient, to operate on him or not, so there are clear-cut guidelines where we should follow. But there are a lot of, sorry to say, but I have seen some places where people have refused HIV patients, and all these things are legally not allowed. You have to treat them. So we have treated a lot of HIV patients, and we have been rehabilitating them, and they feel very confident when somebody thinks there is somebody who can
Some hope.
look after them.
Yes. Some
So
hope is very important for them to
yes, yes,
move ahead.
yes,
Yes, sir.
of course. So now we have WHO staging symptoms where you got stage one, asymptomatic and enlarged lymph nodes only. So where the HIV virus has just gone into the lymph nodes and the lymph nodes are enlarged. So that is stage one, where your CD4 count is above 500. Then you have stage two, where you start losing weight and you get bacterial and fungal viral infections. When your CD4 count is between 500 200, here also it's the risk really starts. And then you have severe weight loss and severe recurrent infections where the CD4 count is below 200, and this is a stage where it becomes very irreversible. Then you have stage 4, where it's a almost terminal stage where wasting and life-threatening infections occur, and the approximate CD4 counts goes below 550. Then,
So, so like
yeah,
just what is the approximate time span of each of the stages, sir? I just like from stage
uh,
one to stage two. Is there any distinct
yes.
time span, or it varies with respect to every patient?
Yeah. So you have an inherent immunity. Every person has his own immunity status. Okay. So that is why it is going to vary. Individual differentiation and varying is there. But if you can treat the patient in before stage one, that is the best time to start an antiretroviral therapy. When you have started antiretroviral therapy because of financial problems or any other problems, because you are not very particular about taking drugs, you don't take drugs, the drugs develop resistance. When the drug develop resistance, then you again restart, it may not work. So you have to take medicines regularly, properly, and proper regime, three drug regime. So there are different so the drugs are selected which acts at different stages of the virus replications. So there are, if you go to an HIV specialist, they have this. This platform is not to discuss what drug and how we select. So there are different level of action of the drugs which we select three and we give the patient, and he takes it lifelong. So if you do that before the stage one or in the stage one also, the it can be prolonged. But once you start after stage three, then the action is limited and patient soon goes into full-blown AIDS. Now, I just described in this program that if you don't treat, then your lifespan is just about 5 to 10 years, and within 10 years, by 10 years, you develop full AIDS and you unfortunately die. So starting antiretroviral therapy is the most important thing. So now coming to prevention, the most important way of transmitting HIV infection is through sexual transmission. So you have to do sex education in school, colleges, how to use condom every time you are, into uh, sexual contact with unknown people or even known people. Use a condom every time. Uh, you have to teach how to really use it practically, properly, how you have to pinch it and then roll it over the male penis so that the semen and the vaginal fluid do not exchange. This is the best thing that you can teach a student, a growing adults, that how to prevent rather than be sorry later, because of the globalization and cultural differences and cultural changes that are happening. People are having multiple partners. People are moving around the world and having multiple partners. It can happen. So to prevent this kind of, because the sexual transmission is the most important way of transmitting the virus. So you have to use this. The next slide, if you see, talk with, you have to talk with your partner. If you're married or if you're not married, you're going to get married, about HIV. Use a condom with your regular and non-regular clients and partners every time you have sex. Reduce the number of main partners. Now these are some of the things which have been given in the national guidelines. uh, get tested, know your status. So at least once in a year, you have to test yourself if you are into those um, groups which I described. If you are a happily married person and staying in the same house and not going out anywhere, I think that's not required. But people who are into those groups have to take care of doing testing once in a year. Who is the most risk for HIV? Anybody having sex without a condom, people with more than one partner who don't use a condom during sex, people whose sex partner have sex with other partners without using a condom. And we have to openly discuss this on this very day of AIDS Day, and not to be very um, hesitant to talk about it openly. That is the most important thing. Uh, So, and the other thing is to the stigma that you mentioned, how you don't get HIV. You cannot get HIV by hugging, touching. The next slide, please. Uh, with or caring for someone with HIV, shaking hands or kissing. You cannot get HIV from eating out of the same plate or cup of utensils that an HIV positive person uses. Next slide. You also have to know that if you are in contact, you not only you have to do test, you also, because the signs and symptoms are like any other flu, like you have fever, fatigue, night sweats, loss of appetite, diarrhea, the most important, swollen lymph nodes. So in that scenario, and once you know that you were in a contact, you should do your test. You cannot tell by looking at someone has, next slide please. You cannot tell by looking if someone has HIV, and individual can look and feel very well for many years and he can be HIV positive. The HIV positive person can pass the virus on to someone else, and hence I particularly feel that it has to be mandatory to do HIV in all individuals before getting married. I may sound little uh, different, but I think that should be done mandatory. Uh, and you should do a lot of rehabilitation of people who already are suffering from HIV and AIDS, and get along with life, and you can support someone with HIV. Diagnosis of HIV. So you have tests like rapid test, TriDot, ELISA, enzyme-linked immunosorbent assays, which you can again confirm by doing viral DNA by RT-PCR, and with different tests you can do in centers. They are done free in HIV centers. Um, and then you have these antiretroviral drugs, which are many, about 12 types. The most common is hadovudine, lamivudine, and uh, tenofovir. So this different types. Next slide, please. Uh, yeah. So you have this nucleoside reverse transcripted drugs. So you got zadovudine, then lamivudine. These are most commonly used. Then you have amitriptyline, tenofovir. So this combination of these four drugs, out of which three can be used, then you can add something like nevirapine. These are the most common drugs used, at least in India. Next slide, please. When to initiate ART? All persons diagnosed with HIV infections are eligible for ART initiation, regardless of CD4 count or WHO clinical staging. any age, adult, adolescent, children, or any population, yeah, you get migrant or NRIs, you can start anytime once you detect HIV. What are the benefits? Next slide, please. So you get reduction of mortality, decreased T cell activation and inflammation, and prevention of HIV transmission. So these are some of the most important things that you benefit by starting early ART. More robust immunological response when treatment is initiated at younger age, and reduce risk of liver disease progression in patients co-infected with HBV and HCV. So these are some sexually transmitted diseases. Uh, then reduction in HIV related morbidity and including tuberculosis. You get less tuberculosis if you start ART soon. HIV associated nephropathy, cardiovascular disease, AIDS defining and non-AIDS defining malignancies, and then neurocognitive complications are reduced if you start it early. So these are some international guidelines. We concentrate on what our national guidelines have told us. So to start ART, a three-drug regime, as soon as possible. Next slide, please. So this is WHO guidelines to start three-drug regime, which we are following here also in India. And I think that completes the discussion almost about HIV. I think I've taken more time, but I've given the full perspective of HIV and AIDS on this day of AIDS Day.
Thank you so much, sir. To hear from you in depth about the whole aspect of HIV and to talk about AIDS is truly something pleasurable, because there are so many facts that we really don't understand, and the moment we have, we say half knowledge is dangerous. So the half knowledge itself is something that inherits, it's like an obstacle for us to even accept certain things. So the way you have explained us and made us understand that there are few things that we have to as change our mindset. That's the most important thing that I feel. So few questions like I would like to put as our viewers have posted. One is, doctor, at what age should we get ourselves tested? Uh, so I feel there was a there was a slide which says that even at 18 months we can start our testing. So could you
So
elaborate on that?
the age is not a bar for testing because it means when you're suspicious that you got HIV, like if you have a mother who's got HIV and the child is born, you definitely have to test the child as soon as possible after the birth to know whether it is infected. So, and not only do immediately after birth, but to repeat it after 12 weeks and maybe after again 6 months. So that early you can do the test in a child born out of HIV mother, or if her partner is also HIV. And for younger adults who are growing up in schools, colleges, if they are sexually active and uh, they have a partner which is unknown, uh, I think they should do any time they feel that they have been exposed, they should do it.
So we have another question which is come up by Ms. Sheetal. She is asking whether HIV testing is a mandatory test during complete body checkup.
In today's scenario, I think you should do it uh, in a complete body checkup. As I mentioned, that if you are a global citizen or moving around states and have a lot of friends, and somehow you go into a sexual relationship with unknown people, or you have unprotected sex, then definitely you should do a complete body checkup. Or you have symptoms which I just described, and also a positive history of having sexual contact or a blood transfusion, then you should do. If you are a thalassemia patient having multiple blood transfusions, If you are unfortunately are addict to drug and you are sharing needles, in those scenario you have to do. If you're a normal, I cannot say normal, if you're an individual who's just going to office coming back, uh, you may not do the test.
We have another question here by Ms. Swasti. She said, "Sir, you mentioned about RT-PCR test. Isn't it the same as the one we are doing for COVID? Please enlighten."
So this is a method of doing the test. This is the method of detecting the virus. So the method can be same, the virus can be different.
Yeah. Okay.
So RT-PCR for COVID, it can be there. It can be also there for HIV.
So there was a question that we would like to ask is, does the mother transfer virus to her child during birth?
Yes, mother can transfer the virus during childbirth. So it is almost 20 to 25% that the transfer occurs, and it occurs because of the once the sac burst, during the normal delivery, there is an exchange also, and there is also blood transmission. But if the child is negative and you have to conduct a delivery, this is something which I'm giving a good information. The caesarean stands, an elective caesarean stands a better option for the child if he is naturally protected as negative, and if you do a cesarean, the high chances the child will be negative later on.
Sir, since we are on childbirth and pregnancy, I would just like to pose a question is, what precaution or treatment should be taken during pregnancy if the mother is HIV patient?
So the precautions that you have to do is you have to first explain the mother that she is positive, and you have to counsel her that if she's taking medicines, high chances that the child may be negative, so she should not stop medicines. You have to really counsel and tell her that after the birth she should not feed the child if she's positive. So breastfeeding should not be done uh, in the child if the child is negative, and to go for an elective cesarean uh, if possible. uh, Mandatory, I would say it should be mandatory that a mother, HIV positive mother, if she is pregnant and during delivery, a cesarean section would be uh, preferable. And a lot of studies have done that it is very for the mother and the child. It is the best procedure.
Yes, sir. Okay. Uh, so in that case, sir, when an HIV positive child, is it possible for an HIV positive child to be admitted in school?
Why not? Because if the HIV positive child is should be taken in the school, because the routine activities that they do with each other is not going to transmit the uh, virus to his friends. It's
So
only when they
because
ensure.
there would be always.
Yes, and not only that, the child also, once he attains a certain age, has to be counseled that he has to understand that he is positive and he will remain positive. At a certain stage of understanding when he grows, you have to rehabilitate and counsel him also. But preventing him from going into the school, it's not only a moral but a social subject. As a doctor, I don't see any reason why he should not be admitted in a school. But socially and
And
morally and legally, I think there are a lot of other platforms where this debate should happen.
true, very true.
I would
Because as a
definitely say, uh,
Sure. Because as a matter of human right, the child is entitled and has the privilege to go to school.
yes,
And being affected by this disease is not could not be considered as one of the reason for not. Yes, definitely there is a stigma that the society puts through when you have a patient, and that's the change in mindset that we have bringing in. And I'm sure, I mean, a lot of efforts have been really taking. If we go back, since you said the starting phase in Chennai to today, if we are seeing the number of years that have passed through, AIDS is something, or HIV as a disease is something that we have really risen over the stigma to a very, very large extent, if I would say. I mean, we are more socially acceptable. We have brought in that flavor of acceptance today to a very large extent. And since we are on this, so we are now working on vaccines for COVID. So, what
yeah.
about any vaccine for HIV? Do we have a
So,
vaccine for?
so that's a very good question. See, COVID vaccines, you all know it's coming in the media. So obviously, the question is why HIV has not got a vaccine.
A vaccine?
So one, the methodology of developing an HIV virus uh, is different. There are a lot of things people are trying to get a HIV virus. There are a lot of proteins on the virus which keep on changing. The virus keeps on changing. So that is why you're not able to uh, put the vaccine for a particular kind of virus with a protein at this site. Once the virus changes the protein sites, your vaccine is not going to be effective. So that is the point. The virus is very labile and it's changing constantly. That is one thing. Secondly, this is a sexual disease, mostly. So 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 much of public health awareness have not worked completely still. At least we are seeing some downward trend. So I think one day when this uh, certain aspects of the virus which cannot change, if that aspect the scientists are working on, if they can develop a virus attacking that part of that virus, I think the vaccine will come.
Surely we'll hope and pray for the best. So here I would also like to ask a question: is surgery possible for a HIV patient? Is it possible to conduct a surgery on an HIV
Of
patient, and
course,
what precautions, if needed, has to be taken?
of course, surgery can be done in an HIV positive patient. Yes, but there are certain uh, criteria. One is the CD4 count. If the CD4 count is very low, then the outcome, whether the surgery is an emergency surgery, then only you should do it. An elective surgery with a CD4 count very low is going to be uh, unnecessary. Like doing a cosmetic surgery for a CD4 count which is very low, it's futile. Yes, emergency surgery you should always do. But if the CD4 count is good and the patient requires any kind of surgery with due precautions of the operation theater management, the patient counseling, the staff counseling in the operation theater, the doctor should do. You should also make aware people of taking, a needle stick injury prophylaxis. If you get inadvertently pricked by the needle, the doctor can get it, or the staff nurse can get it, or somebody can get it. You have to dispose the operation theater materials in a proper incinerator. All these things should be carried out. But yes, the HIV patient can be operated. It is his right to get operated in emergency and even in semi-emergency. So the stigma, I just one point I wanted to tell you, the stigma of not talking, not counseling, not teaching the children has really created a problem For example, in a school, if because of the stigma, the child doesn't tell that he is positive, then what? Or the parents do not say that the child is positive, you will not come to know because there are no symptoms. It's better to
True.
discuss it openly. Yeah.
Sir, I just wanted to know, is suppose if a patient who is suffering from HIV has got is treated and becomes fine. So how long does he or she have to go a repetitive test yearly or maybe in once in 5 years to just check, or is there any relapse that have you heard about any relapse of any incidents of HIV coming back
HIV, no, no, no. I'm not. If I understand your question properly, if the patient is HIV positive,
positive,
then
and he and
how
he's treated
how
well, and there is treatment given, and now then we find out now he's not positive, or if he's treated well, so is there
so it
any
doesn't
other?
happen. Yeah, let me stop you there because an HIV positive patient never becomes HIV negative. It, like there are certain reports that with Ayurvedic medicines and this
Hmm.
medicines and that medicines it become negative. If you ask me, then the patient was not positive.
So there is no
If he's
complete
becoming negative,
recovery that we speak, but
yeah.
we
So
stop the growth.
yes, you
Yeah,
stop
yeah.
and you control the infection for a long period,
Hmm.
and he can live a very healthy life if he
Okay.
takes care properly. That much I can tell you. And then definitely he should do his CD4 count every year
Hmm.
to find out how he's progressing.
So the detection is very important, because early detection will help you to control as well as not just, it's like malignant, and to avoid the malignancy to grow further, it is very important that you keep it under proper
Right,
control. Yeah,
right.
yeah. So thank you so much, sir, for your valuable advice and your insight. There are a lot of things. So we have been doing sessions, but to get a doctor's perspective, probably this is the first time that PCR Chembur has taken this initiative to get a doctor's perspective and to understand it in a more simpler way. I'm sure our viewers are really enlightened, because this the basic understanding is, today we have had a session, we have had a one-to-one session, but this is going to be live, and it's going to be an eye opener for many who couldn't be a part of the session. And this is just one rippling effect which we will be seeing in spreading more and more awareness about this disease. Like you rightly said, it is not that you detach themselves from the community, but you bring them back to the community, attach themselves in such a manner that you really feel that they are also a part of your community, and they also have the right to survive. This HIV cannot just uproot them from the system, but rather than hold them, and we as all individuals take collective efforts in bringing them or making them to strong, and having making them also a place to live happily and successfully. So thank you so much, sir. We are really enlightened that you are here. You could give us your valuable time. I do understand, in spite of your busy schedule, you could give us this valuable time. It's a pleasure from us. Thank you so much, and thank you, and signing off. Bye, sir.
Absolutely true. I totally agree, and I thank you for this wonderful session. I think we have made this AIDS Day a truly informative day from our side.
Yes, sir. Thank you, sir.